Hello everyone, I am Dr. Srijitra from Exambla Healthcare. Today I am here to talk about a very commonly seen lifestyle disease of our time, hypertension or increased BP. So let's see in detail what is hypertension, what are the symptoms of it, what are the complications of it, and what are the things that we have to change in our diet to control or to manage hypertension. So all these things we can look in detail. So starting with, what is hypertension? Hypertension is nothing but increased blood pressure or increased pressure in your artery or in your blood vessels which carries the blood. So if that pressure persists for a period of time, then it will start affecting all your vital organs, especially your heart and your brain. You will have an increased chance for getting a heart attack or a stroke. So managing hypertension is very important in your day-to-day life. So how does this hypertension happens? So people above 40 have an increased chance for getting hypertension. Hypertension happens because of two reasons. The first reason is there is an increased blood flow in your artery. This can happen because if there is too much of water retention in your body. If there is too much of water retention, then definitely the quantity of the water flow will be more. So definitely you will be having too much of hypertension. That is the reason why we are asking you to reduce the salt quantity, because more salt means more retention of water. So that will definitely give rise to more pressure. And the second reason is that if the contraction and the relaxation of the artery is not happening properly, again you will be hypertensive. Because as you know, the artery is one of the blood vessels which have muscle in it. Unlike vein, artery have muscle on their own. So this muscle will contract and relax. There are a lot of factors which contribute for the contraction and relaxation. Especially if you look into the minerals, calcium is especially responsible for the contraction of the blood vessel. And some minerals like magnesium and potassium will help in the relaxation of the blood vessels. So if the muscle structure is not proper and if these elements are missing in it, especially magnesium and potassium, the contraction will happen but the blood vessel may not relax properly. So what happens is, in a narrowed blood vessel, the blood will be forced to pass through this narrowed blood vessel, which will again give rise to blood pressure. So in the treatment of hypertension, avoiding sodium or salt is also important, and also make sure that your magnesium and potassium levels are in the range. So this is the element which will help in the relaxation of the blood vessels. And also iron. Iron is very much important because iron carries oxygen. So oxygenation of the muscle is very important for maintaining the integrity, maintaining the muscle structure and things like that. If the muscle is not functioning properly, this can also because of the lack of iron in it. So these elements has to be properly balanced. Saying that, you also have to understand that lack of sleep or too much of tensions, these factors will give rise to a lot of stress hormones like cortisols. So this will help in the contraction again, the contraction of the blood vessels. So that is why if you are prolongedly stressed, if you are prolongedly not sleeping properly, your blood pressure might rise. So these are the factors which are contributing to the blood pressure. The symptoms of hypertension are usually very mild or ignorable, or there won't be much symptoms at all. Sometimes people might complain of headache, giddiness, a bit of heaviness and neck pain and things like that. But usually the symptoms are very mild or ignorable. So that is the reason why hypertension is often called a silent killer, because you will never know, unless you check it, you will never know there is hypertension. It is not like any other disease. There won't be much symptom of it. So one day if you get the chest pain and cardiac pain, that is the time when you will realize that you are hypertensive. So make sure that if you are 40 and above, the proper and regular checking of your blood pressure is mandatory, because most of us will not have much symptom. So you do please check your blood pressure regularly if at all you are above 40. So what are the treatments available for hypertension? In homeopathy, while treating hypertension, we also look into the causes which is stimulating the hypertension. It can be the stress factor, it can be the sleep factor, it can be the cholesterol factor, hypercholesterol factor. There will be a lot of reasons why you are ending up in hypertensive stage. So we will look into the causative factors. We will look into other factors like diabetic or your body constitutions and things like that, and we try to give you a holistic medication, because over the period of time we will have to change back the patient's health back to normal and we have to withdraw the medication. Homeopathic medications for lifestyle diseases are not meant to continue for lifelong, because we will be able to reverse back your condition, especially if you are in the initial stage. We will be able to reverse back your condition and bring back to normal, and we will be able to withdraw the medications. So saying that, the medication have one part in treating hypertension, and we have to look into the diet and exercise as well. So like any other disease, exercise is mandatory in treating hypertension. Regular 1 hour of walking, any kind of sweating exercise or any kind of yoga has to be practiced regularly in a daily basis. That is very important in treating hypertension. Water intake is also very important. 3 liters of water per day, because water will flush out too much of minerals and salt from your body through urine. So drink proper amount of water regularly. So usually we will say daily intake of salt should be regulated somewhere between 5 grams. But for hypertensive patient, it has to be reduced to 2 grams. So instead of using normal salt, you can use pink salt or Himalayan salt, because Himalayan salt or pink salt is very much rich in potassium and magnesium. So these elements are very much important in reducing hypertension, because that will help in relaxing the muscle or relaxing the arteries. So you try to substitute your normal salt with pink salt and reduce the amount to 2 grams per day. The third point is body weight. The body weight has to be regulated. If you reduce your body weight, accordingly your blood pressure also will comes down. And the total calorie intake, you have to reduce a lot of junk foods, you have to reduce a lot of packed foods, too much of salted or saturated foods you have to avoid. Your daily calorie intake should be 30 calories per kilogram. So what is your body weight, accordingly you have to measure the calories, and if you try to restrict your calorie intake to 30 calories per kilogram, that will help in reducing your blood pressure as well. And I have already said the anxiety, tensions, those things has to be reduced, because they will release certain hormones which will help in the contraction of the blood vessels. So you please practice meditation, you please practice pranayama. This will help in reducing your stress level. It will calm your mind. So you practice meditation and pranayama daily, at least for 10-15 minutes daily in the morning. If you practice, it will reduce your stress level. So practice that, and you try to bring down your anxiety level. And sleep. Sleep is a must, especially continuous 8 hours of sleep is mandatory in treating hypertension. So no matter how much tablet you take, no matter what kind of things you do, if you don't sleep properly, the blood pressure might rise. So make sure to sleep properly. At least 8 hours of sleep is mandatory in keeping your blood pressure under check. And the last thing, if you are in the habit of smoking, drinking or anything, it is important that you discontinue that or taper it down and control your addictions, because these things can again cause blood vessel contraction, because alcohol intake will cause a lot of water retention in your body. Smoking will cause the vascular contractions. So these things has to be avoided. So if you are in a habit of taking these things, make sure you taper it down and stop it eventually, because it is very bad for your health. So these are the things that I want to talk about regarding hypertension. If you really enjoyed this video, please make sure to like, comment and share, and also don't forget to subscribe to our channel, so that we can get back to you with new videos regarding health, both mental health as well as physical health. So saying that, you stay healthy and fit and take care of yourself. Thank you.